So today I'm going to talk about the actual clinical use of microbiome testing in relationship to women longevity and female hormones. However, I was a little bit surprised in the previous presentation because the actual accuracy and reproducibility of microbiome testing has been very heavily questioned. So before actually proceeding with my presentation, I would like to clarify that the actual technology that I've been using in the last couple of years is extremely accurate. So we are using a new technology combining 16S, 23X, so we are able to actually identify any possible bacteria in the gut microbiome down to the strain level. And we publish numerous studies that can demonstrate that our results are totally reproducible and absolutely accurate. I think this was a very important clarification given the previous presentation, because otherwise anything that I can say regarding the microbiome doesn't make sense. All right, so first of all, is it possible to talk about a healthy microbiome? How we do define what is a normal and healthy microbiome? We do have very specific markers that actually help us define what a normal microbiome is. So the very first one is what we call diversity, alpha diversity. And alpha diversity is made by richness and evenness, which means when we look at the microbiome profile of a patient, we want to have as many different species as possible. This is called richness. But at the same time, we want to have evenness. So we don't want to see one or two or three specific bacteria to overgrow or to be overdominant, okay? The second kind of metrics that we are looking at is the low relative abundance of problematic bacteria. For example, we want to see as low as possible pathobionts, pathogen. We want to see as low as possible relative abundance of proteobacteria, for example. Why? Because proteobacteria are gram-negative bacteria. They contain lipopolysaccharide, LPS, and LPS is a very strong immune activator. It causes a lot of inflammation. So for example, in neurodegenerative disorder like Alzheimer and Parkinson, or many inflammatory disorders, we see that the relative abundance of proteobacteria is normally very, very high. And finally, we don't want to see any fusobacteria. Why? Because fusobacteria has been very strongly demonstrated. They are strongly associated with cancer. For sure, with colorectal cancer, we are actually gathering more and more information regarding the association between fusobacteria and pancreatic cancer, but also breast cancer, endometrial cancer. Number three, we want to see a very normal and balanced abundance of beneficial bacteria, such as probiotics, short-chain fatty acid producer, protector of the mucosa, such as Akkermansia mucinifila, Faecalibacterium prausnitzii. Then we want to have a very good resistome. So we don't want to have a very high abundance of bacteria that carry antibiotic-resistant genes. We want to have a normal ratio between the two major phyla, so Firmicutes and Bacteroidetes. And we want to have a normal, again, abundance of bacteria that are normally associated with key metabolic pathways, such as production and metabolism of bile acid, kynurenine, indole production and metabolism. So if you are able to keep all these metrics under control, we can say your microbiome is very resilient. What does it mean? It means that if something happens that is perturbating the normal balance in a microbiome, such as you are taking antibiotics, you are going through a major surgery, or you are facing some sort of infection, if your microbiome is very resilient, it's going to be able to bounce back to the normal composition, okay? Is that actually relevant in terms of longevity? Absolutely yes. If you are able to maintain all these key metrics of the microbiome very stable over the years, you're going to live longer. And it's been demonstrated that in supercentenarian, in superager, they normally have a very normal, very nice richness and evenness. There is a very low abundance of proteobacteria, pathogens, so it's very much relevant. But when it comes to female, women longevity, is it true that in female microbiome, there are very specific bacteria? So there is a very strong difference, what we call a sexual dimorphism in terms of microbiome. If you look at the scientific literature, you're gonna find a lot of papers saying, yes, there are some bacteria that are very strongly associated only with women, and some others that are very strongly associated with men. From a clinical point of view, I can tell you this is not really true. Meaning that there are other factors such as diet, physical activity, drugs, supplements, that can actually affect the microbiome composition far more than sex hormones. But why female sex hormones are very important in relationship with the microbiome? Well, because especially estradiol is able to maintain all the key metrics I was talking about before. So if you have low level of estradiol, the relative abundance of many beneficial bacteria actually decrease. Okay, progesterone, yes, we do have some evidence that progesterone can actually help maintain a healthy microbiome, but it appears that estradiol specifically is far more important. Having said that, what happens during menopause then? When we actually lose completely the ability to produce in our ovary progesterone and estradiol, is there any specific kind of consequence, negative consequence on the microbiome? Yes. And the consequences are not just on the intestinal microbiome, but also on the other microbiome. The oral microbiome, for example, so we lose the diversity in the microbiome in the mouth. Some negative bacteria, example again, Fusobacterium, can actually increase in the oral microbiome. In the genital microbiome, genitourinary microbiome, we also see a negative differences. So there are more bacteria associated with the inflammation, and also possibly they can cause cancer. When we talk about microbiome and female health, one important part is about what we call estrobolome. Estrobolome is the collection of all the bacteria and the genomes in the gut microbiome. They are able to recirculate estrogen. Means that, as you probably know, estrogen undergo a very extensive liver detoxification, so phase 1 and phase 2. In phase 2 detoxification, estrogen are actually deconjugated. They are conjugated with glucocoronidases. There are many bacteria in the gut that have an enzyme called beta-glucuronidase, which is able to deconjugate the estrogen and their metabolites, meaning that all these metabolites, even the parent's estrogen, can actually increase, can re-enter the enterohepatic circulation, which means that much more estrogen is available. This can have a very strong, for example, effect on the risk of breast cancer. So this is why we want to manipulate the microbiome of female, because it can have a protective or even detrimental effect on the risk of cancer, especially breast cancer and endometrial cancer. Very final slide is about a very interesting link in women only between the risk of colorectal cancer and breast cancer. We know that women who had previously breast cancer have a much higher risk of colorectal cancer. Why is that? Well, obviously there are many possible explanations, like very bad diet, visceral adiposity, chronic inflammation. But in reality, what we are observing more and more is that the cancer, colorectal cancer microbiome, actually show some bacteria that are also found in breast cancer, okay? I want to talk about a very specific case study so that you can actually see that in clinical practice it's absolutely necessary to use microbiome testing. Female patient, Indian, by the way, with breast cancer, BRCA positive. The patient is vegan, so she's not eating any animal fat, animal protein. She's very deficient in vitamin D, in vitamin B12, and she showed in her microbiome a very high abundance of fusobacterium. What is the clinical actually significance of that? I changed the diet of the patient, and I actually applied a few protocols to decrease the fusobacterium. Why is that? Because I want to prevent not only the recurrence of breast cancer, but I want this patient to avoid also colorectal cancer. So this is what really means to personalize an intervention. You want to treat the patient, but also you want to prevent future problems, okay? And this is a very practical clinical implementation of the microbiome test. So conclusion, is microbiome important in longevity? I think it's pretty clear, yes, it is. If you can maintain a normal microbiome profile, you are going to live probably much longer and in better health. For women, it's especially important because of the various combination of different microbiomes. So the oral microbiome, the vaginal microbiome, the breast microbiome, and obviously the intestinal microbiome. If you want to maintain a very good health, you need to work on the estrobolome. Problem is, be careful with the supplementation. If you are not sure about what you are talking about, if you are not able to interpret a microbiome report, don't give supplements. Especially don't give probiotics, okay? Because even the very good bacteria like lactobacilli, bifidobacterium, they do have beta-glucuronidase activity. So you can even increase the metabolite of estrogen. So every time that you are doing any kind of intervention on your patient, be careful and test the microbiome. Thank you very much. If you have any question, I'm more than happy.
Thank you, Dr. Elena. This was a very informative deep dive between female hormone health and microbiomes. We can take some questions.
Are there, we've mentioned about fusobacterium. So, can there be, can you mass give women targeted things for fusobacterium without having to test the microbiome? Is there any disadvantage of it?
No, if you really want to know whether there is fusobacterium either in the intestinal microbiome, in the vaginal microbiome, in the breast microbiome, you need to test. There is no other way.
Okay, so without testing, you cannot necessarily.
You cannot predict anything, obviously no.
Hi, so I'd like to understand were the outcomes presented based on Indian population?
Yes, the patient I was talking about, the little short case study, is an Indian patient. So I've been working in the last couple of years with Indian patients, so I'm talking about Indian typical references, so yes.
Got it. Apart from the singular patient, do you also have the remainder of conclusions providing, evidenced on Indian?
Yes. So basically what we do in microbiome research is to have very precise reference range. For example, Akkermansia. Akkermansia is considered a very protective bacteria. But the reference range for the Caucasian population is completely different compared to the Asian population and the India population. So we always make some sort of analysis based on very specific population reference range.
Hi. Hi, doctor. So your presentation was wonderful. I'm wanted to know that basically in case of gene lineage, supposes somebody has a history, genetic history of mother having cancer, breast cancer, or some other kind of cancer, it translineates into the daughter might be having cervical cancer, not the exact same kind of cancer. So does your this particular study also include the gene lineage in this entire?
Yes, just to clarify, because I work as a personalized nutritionist, I normally combine many different kinds of testing. So it's not that I use only microbiome. When I have a patient like the patient I was talking before, I combine blood test, nutrigenetic, genetic, metabolomics, and microbiome. It would not be possible to actually have a very personalized intervention based simply on microbiome. So yes.
So just to add on, you also use chemotherapy and radiotherapy along with this.
I don't use personally
Yeah, but
chemotherapy, but I can personalize, for example, the response to chemotherapy, can decrease the side effect. And I obviously want to work on, for example, fusobacteria, okay? So to optimize the overall response.
All right, thank you.
My question is there an observation that you've made that around menopause is when the aging advances or is rapid for women? Is there a change in the microbiome which can contribute to either amelioration of the chronic complaints that they've been having, like endometriosis or
Yes.
any other menstrual disorders?
Absolutely. As I was saying during the presentation, during menopause, because of the very drastic decline, especially in estradiol, you're going to see very negative effect on the microbiome. As I said, not just intestinal microbiome, but also vaginal, oral, breast, okay? So if you want to improve the longevity of women and the lifespan, or better, the health span of women, you need to work on the microbiome, but also optimize the level of hormones. So it's not sufficient to work on the microbiome. You need to optimize the level of female hormones. So for example, through HRT, which I think is by far the most important longevity kind of intervention for women.
Hi, Dr. Elena. Just a quick question, are similar studies also conducted on PCOD or PCOS?
Absolutely, yes. We do have plenty of evidence that show that there is a very strong correlation between specific microbe and PCOS, endometrial cancer, endometriosis, fertility problem. And most of these problems are again correlated with fusobacterium, by the way.
Thank you so much, Dr. Elena.